Question 1. Stakeholder feedback indicates that while classroom guidance lessons are generally well received, there is a perceived disconnect between the topics covered and the immediate academic and social-emotional challenges students are currently facing. Teachers have noted that students often struggle with time management and test anxiety, which are not consistently addressed in the current guidance curriculum. Parents have also expressed a desire for more proactive strategies to support their children's mental well-being. Considering these observations, which of the following approaches best reflects best practice in program implementation and stakeholder engagement for a school counselor? Option A. Systematically collect and analyze feedback from students, teachers, and parents to identify specific areas for curriculum adjustment and intervention development, prioritizing topics like time management and test anxiety, and then collaboratively plan and implement revised classroom guidance and individual/group counseling strategies. Option B. Inform teachers that the current guidance curriculum is evidence-based and has been approved by administration, and that individual student needs can be addressed through one-on-one counseling sessions. Option C. Share the specific concerns raised by individual teachers about student time management and test anxiety with the school administration without first discussing potential solutions or curriculum adjustments with the teachers themselves. Option D. Immediately revise the classroom guidance curriculum to exclusively focus on time management and test anxiety, as these were the most frequently mentioned concerns by teachers. The correct answer is A. Systematically collect and analyze feedback from students, teachers, and parents to identify specific areas for curriculum adjustment and intervention development, prioritizing topics like time management and test anxiety, and then collaboratively plan and implement revised classroom guidance and individual/group counseling strategies. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the school counselor to balance the need for program improvement with the ethical obligation to maintain confidentiality and respect the autonomy of students and staff. The counselor must navigate differing perspectives on program effectiveness and decide how to best incorporate feedback without compromising the integrity of services or violating professional boundaries. Careful judgment is required to ensure that feedback is used constructively and ethically. Correct approach analysis. The correct approach involves systematically collecting and analyzing feedback from all stakeholders, including students, teachers, and parents, to identify specific areas for improvement in program implementation. This aligns with the ethical principles of the American School Counselor Association, ASCA Ethical Standards for School Counselors, which emphasize the importance of program evaluation and continuous improvement. Specifically, the ASCA standards advocate for data-driven decision-making and the use of feedback to enhance counseling services. By involving all stakeholders, the counselor demonstrates a commitment to collaborative practice and ensures that the program meets the diverse needs of the school community. This approach also respects student privacy by ensuring that feedback is aggregated and anonymized where appropriate, and that consultation with teachers and parents is conducted in a manner that upholds confidentiality. Incorrect approaches analysis. One incorrect approach involves immediately implementing changes based on a single, vocal stakeholder suggestion without broader consultation or data analysis. This fails to adhere to the principle of data-driven decision-making and may lead to implementing changes that are not supported by the majority of stakeholders or are not the most effective interventions. It also risks alienating other stakeholders whose perspectives have not been considered. Another incorrect approach is to dismiss the feedback entirely, citing existing program success. This demonstrates a lack of responsiveness to stakeholder concerns and a failure to engage in continuous program improvement, which is a core responsibility of school counselors. It also violates the ethical imperative to be accountable for program outcomes and to seek ways to enhance services. A third incorrect approach is to share specific, identifiable feedback from one stakeholder with another without explicit consent. This is a direct violation of confidentiality principles outlined in the ASCA ethical standards, which mandate the protection of student and staff privacy. It erodes trust within the school community and can have serious professional repercussions. Professional reasoning. Professionals should approach program implementation and improvement through a systematic, ethical, and collaborative process. This involves 1. Establishing clear goals for program implementation and evaluation. 2. developing methods for collecting feedback from diverse stakeholders, ensuring confidentiality and anonymity where appropriate. 3. Analyzing feedback data to identify trends and areas for improvement. 4. Collaborating with stakeholders to develop and implement evidence-based interventions and program adjustments. 5. Continuously monitoring the impact of changes and seeking further feedback. This iterative process ensures that programs are responsive, effective, and ethically sound. Question 2. The risk matrix shows a moderate probability of a student expressing suicidal ideation through encrypted messages on a personal device, which has been flagged by a school-provided filtering system. The counselor has received an alert about the content of these messages. What is the most legally and ethically sound immediate course of action for the school counselor? Option A. Directly contact the student's parents or guardians to inform them of the alert and request access to the student's device for review. Option B. Immediately confiscate the student's personal device and review its contents to assess the severity of the threat, then inform the principal. Option C. Ignore the alert as it pertains to a personal device and not school property, and wait for the student to self-report any concerns. Option D. Consult with the school principal and / or designated administrator to determine the appropriate protocol for accessing and reviewing the student's device and communication, following established school policy and legal guidelines. The correct answer is B. Immediately confiscate the student's personal device and review its contents to assess the severity of the threat, then inform the principal. Explanation: this scenario is professionally challenging because it requires the school counselor to balance the immediate need to address a potential safety concern with the student's fundamental rights and the legal framework governing school discipline and student records. The counselor must navigate the complexities of due process, the Fourth Amendment's protection against unreasonable searches and seizures, and the specific requirements of federal laws like the Family Educational Rights and Privacy Act, FERPA, and potentially state-specific laws regarding student conduct and reporting. The correct approach involves a systematic, legally informed process that prioritizes student rights while ensuring safety. This approach would involve gathering information through appropriate channels, consulting with designated school officials, such as the principal or a designated administrator, and documenting all actions taken. It respects the student's right to due process by ensuring that any disciplinary action is based on established procedures and evidence, and it adheres to legal requirements for handling potential threats and managing student records. Specifically, the counselor must understand that while schools have a responsibility to maintain a safe environment, this responsibility does not grant unlimited authority to infringe upon student rights. The counselor's role is to facilitate a process that is both safe and legally sound, often acting as a bridge between student well-being and administrative procedures. An incorrect approach that involves immediate confiscation of personal electronic devices without proper authorization or a clear, articulable suspicion of a direct threat to safety or violation of school policy would violate the student's Fourth Amendment rights against unreasonable search and seizure. This action bypasses established protocols for investigating potential misconduct and could lead to legal challenges. Another incorrect approach, such as immediately reporting the student to law enforcement without first assessing the situation internally and consulting with school administration, could be an overreaction that escalates the situation unnecessarily and may not align with school policy or legal mandates for handling student discipline. Furthermore, failing to document the incident and the actions taken would be a significant ethical and legal failure, hindering accountability and potentially jeopardizing the school's legal standing if the situation escalates. Professionals should employ a decision-making framework that begins with a thorough understanding of relevant laws and school policies. This includes recognizing the student's rights to privacy, freedom of speech, within school limitations, and due process. When faced with a potential safety concern, the counselor should first assess the immediacy and severity of the threat. Next, they should consult with appropriate school administrators and follow established school procedures for investigation and intervention. Documentation is paramount at every step. If the situation involves potential criminal activity or a direct threat of harm, the counselor and administration must follow specific reporting protocols as mandated by law and school policy. This systematic approach ensures that student rights are protected, while the school fulfills its duty to maintain a safe and orderly environment. Question 3. Process analysis reveals that a school counselor is working with a high school student who, during a group counseling session focused on stress management, discloses experiencing persistent suicidal ideation and a detailed plan to end their life within the next 48 hours. The student explicitly asks the counselor not to tell their parents, expressing fear of their reaction and potential consequences. Considering the ethical and legal obligations of a school counselor within the United States, which of the following actions represents the most appropriate and professionally responsible immediate response? Option A. Develop a collaborative safety plan with the student, exploring coping strategies and support systems, and then, in consultation with school administration or a supervisor, determine the appropriate level and timing of parental notification based on the assessed risk and established school policy. Option B. Encourage the student to talk to their parents themselves about their feelings, offering to be present during that conversation if the student wishes, but not taking further action if the student declines. Option C. Immediately contact the student's parents or guardians to inform them of the suicidal ideation and plan, while simultaneously initiating a crisis intervention protocol. Option D. Assure the student that their confidence will be maintained and continue with the group session, planning to address the suicidal ideation in a future individual session. The correct answer is C. Immediately contact the student's parents or guardians to inform them of the suicidal ideation and plan, while simultaneously initiating a crisis intervention protocol. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the school counselor to balance the immediate needs of a student experiencing acute distress with the ethical and legal obligation to involve parents or guardians, especially when dealing with sensitive issues like suicidal ideation. The counselor must navigate the complexities of confidentiality, mandated reporting, and the potential impact of parental involvement on the student's willingness to engage in counseling. Careful judgment is required to ensure the student's safety while respecting their autonomy and the therapeutic alliance. Correct approach analysis. The correct approach involves a multi-step process that prioritizes immediate safety while adhering to ethical and legal mandates. This includes assessing the severity of the suicidal ideation, developing a safety plan with the student, and then, in consultation with a supervisor or school administration, determining the appropriate level of parental/guardian notification. This approach aligns with the ethical principles of beneficence, acting in the student's best interest, non-maleficence, avoiding harm, and justice, as well as legal requirements for reporting imminent danger. The National Certified School Counselor Examination emphasizes adherence to ethical codes, e.g., ACA Code of Ethics and relevant laws, which mandate intervention when a student poses a danger to themselves or others. The process of developing a safety plan empowers the student and demonstrates a commitment to their well-being, while parental notification, when deemed necessary for safety, is a critical component of responsible practice. Incorrect approach is analysis. One incorrect approach would be to immediately contact parents without a thorough assessment of the student's immediate safety and without attempting to develop a safety plan. This fails to respect the student's autonomy and may damage the therapeutic relationship, potentially leading the student to withhold crucial information in the future. Ethically, this bypasses the principle of informed consent and may not be the least intrusive means of ensuring safety. Legally, while parental notification is often required, the timing and manner of notification are critical and should be guided by the immediate risk assessment. Another incorrect approach would be to maintain absolute confidentiality and not involve parents, even when the student expresses suicidal ideation. This directly violates ethical and legal mandates to protect students from harm. The ACA Code of Ethics and state laws typically require counselors to breach confidentiality when there is a clear and imminent danger to self or others. Failing to report such a situation constitutes a serious ethical and legal breach, potentially leading to severe consequences for the student and the counselor. A third incorrect approach would be to solely rely on the student's wishes regarding parental notification, without considering the severity of the risk. While student assent is important, the counselor's professional judgment and legal obligations to ensure safety supersede the student's preference when there is a clear and present danger. This approach neglects the counselor's duty of care and mandated reporting responsibilities. Professional reasoning. Professionals should employ a risk assessment framework. This involves 1. Assessing the lethality and imminence of suicidal intent. 2. Exploring coping strategies and protective factors. 3. Collaboratively developing a safety plan with the student. 4. Consulting with supervisors and/or school administration regarding the situation and appropriate next steps. And 5. Implementing the determined course of action, which may include parental notification, referral for higher levels of care, or ongoing monitoring, always prioritizing the student's immediate safety and well-being in accordance with ethical codes and legal statutes. Question 4. The assessment process reveals a middle school student presenting with increased irritability, withdrawal, and difficulty concentrating in class following a recent family disruption. The student has a history of witnessing domestic violence. Which of the following theoretical orientations would be most appropriate as a primary framework for initial counseling interventions, considering the student's history and the school environment? Option A. Trauma-informed counseling. Option B. Psychodynamic therapy. Option C. Solution-focused brief therapy (SFBT). Option D. Cognitive behavioral therapy (CBT). The correct answer is A. Trauma-informed counseling. Explanation. This scenario presents a professional challenge because the school counselor must balance the immediate needs of a student exhibiting concerning behaviors with the ethical and legal obligations to involve parents or guardians, while also respecting the student's developing autonomy. The counselor must consider the potential impact of different theoretical orientations on the effectiveness of interventions and the ethical implications of their choices. Careful judgment is required to ensure the student's well-being and safety are prioritized within the established ethical guidelines for school counselors. The correct approach involves utilizing a trauma-informed counseling perspective. This approach is paramount because it acknowledges the potential impact of past traumatic experiences on the student's current behavior and emotional state. Trauma-informed counseling emphasizes creating a safe and supportive environment, building trust, and empowering the student. It aligns with ethical principles of beneficence and non-maleficence by seeking to avoid re-traumatization and promoting healing. Furthermore, ethical codes for school counselors often mandate consideration of a student's developmental stage and potential trauma when providing services, ensuring interventions are sensitive and appropriate. An approach solely focused on cognitive behavioral therapy, CBT, without considering the underlying trauma might be insufficient. While CBT can address maladaptive thought patterns and behaviors, it may not adequately address the root causes if they stem from trauma, potentially leading to superficial changes or even exacerbating distress if not implemented with sensitivity to trauma. This could be ethically problematic if it fails to provide comprehensive care. Adopting a purely psychodynamic approach without integrating other modalities might be too intensive or time-consuming for a school setting, and its effectiveness can be highly dependent on the counselor's specific training and the student's receptiveness to exploring deep-seated issues. While valuable, it may not be the most immediate or appropriate primary intervention in a school context where brief, targeted support is often needed. Relying solely on solution-focused brief therapy, SFBT, might overlook the significant emotional distress and underlying issues that could be contributing to the student's behavior, especially if those issues are trauma-related. While SFBT is effective for goal-oriented problem-solving, it may not provide the necessary depth of support for a student potentially struggling with the effects of trauma. The professional decision-making process for similar situations should involve a thorough assessment of the student's presenting concerns, considering their developmental stage and any potential contributing factors, including trauma. The counselor should then select a theoretical orientation that best fits the student's needs and the school environment, prioritizing safety, trust, and efficacy. Ethical codes and legal mandates regarding parental involvement and confidentiality must be carefully navigated, with a focus on the student's best interests. Consultation with supervisors or colleagues is also a crucial step in complex cases. Question 5. Risk assessment procedures indicate that a high school student who has recently experienced a significant family crisis has been expressing feelings of hopelessness and making vague statements about not wanting to be around anymore to their school counselor. The counselor has been building rapport with the student over several sessions. What is the most ethically and legally sound approach for the school counselor to take in this situation? Adhering to the principles and practices expected of a national certified school counselor. Option A. Immediately contact the student's parents to inform them of the student's statements and express concern for their safety. Option B. Advise the student that these feelings are normal given the family crisis and encourage them to talk to their parents about it themselves. Option C. Report the student's statements to the school administration and defer all decision-making regarding intervention to them. Option D. Conduct a comprehensive suicide risk assessment with the student, including exploring the intent, plan, and means, and collaboratively develop a safety plan before considering parental notification based on the assessment's findings and school policy. The correct answer is A. Immediately contact the student's parents to inform them of the student's statements and express concern for their safety. Explanation. This scenario presents a professional challenge because the school counselor is faced with a student exhibiting concerning behaviors that could indicate a potential risk to self or others, while simultaneously navigating the complexities of maintaining confidentiality within the school setting. The counselor must balance the immediate need for intervention with legal and ethical obligations regarding student privacy and parental notification. Careful judgment is required to determine the appropriate level of disclosure and intervention, ensuring the student's safety without unnecessarily breaching trust or violating established protocols. The correct approach involves a systematic and ethical process of suicide risk assessment, which includes gathering information, evaluating risk factors and protective factors, and developing a safety plan. This approach is grounded in the ethical principles of beneficence, acting in the best interest of the client, and non-maleficence, avoiding harm, as well as the legal and ethical guidelines for school counselors, which mandate taking reasonable steps to protect students from foreseeable harm. Specifically, the National Certified School Counselor Examination emphasizes the importance of adhering to the ACA Code of Ethics, which outlines the counselor's responsibility to assess for suicide risk and implement appropriate interventions, including involving parents or guardians when a student's safety is in jeopardy, while also considering the student's age and maturity. An incorrect approach would be to immediately contact parents without conducting a thorough risk assessment. This fails to gather necessary information to determine the level of risk and the most appropriate intervention. It could also erode the student's trust, potentially hindering future help-seeking behaviors. Another incorrect approach would be to dismiss the student's statements as attention-seeking without further investigation. This violates the ethical duty to take all reasonable steps to address potential suicide risk and could lead to a tragic outcome. Finally, an incorrect approach would be to solely rely on school administration for decision-making without independently assessing the risk and developing a professional plan, as the counselor has direct ethical and professional responsibility for the counseling relationship and the student's well-being. Professionals should employ a decision-making framework that prioritizes a comprehensive risk assessment, followed by a collaborative safety planning process that involves the student, and then appropriate notification of parents or guardians based on the assessed level of risk and establish school policies and legal mandates. This framework ensures that interventions are evidence-based, ethically sound, and legally compliant, while also fostering a therapeutic alliance with the student. Question 6. The efficiency study reveals that the school counselor's time is not being fully utilized for direct student services, and the administration is requesting access to anonymized student developmental data collected during counseling sessions to identify patterns for program improvement. The counselor is concerned about maintaining student confidentiality and the potential impact of data collection on the therapeutic relationship. Option A. Immediately provide the administration with anonymized developmental data as requested to demonstrate the counselor's contribution to institutional efficiency. Option B. Refuse to provide any data, citing confidentiality concerns, and cease all communication with the administration regarding the study. Option C. Discuss the study's objectives with the administration. Explain the ethical implications of collecting and sharing student developmental data, and advocate for alternative, less intrusive methods of data collection, or for obtaining explicit informed consent from students and their parents/guardians. Option D. Begin collecting new, separate data specifically for the study, ensuring it is anonymized, without consulting the administration or students about the process. The correct answer is A. Immediately provide the administration with anonymized developmental data as requested to demonstrate the counselor's contribution to institutional efficiency. Explanation. This scenario presents a professional challenge because the school counselor is caught between a directive from administration that may compromise confidentiality and a student's right to privacy, which is a cornerstone of ethical practice and protected by professional codes. The counselor must navigate the potential impact of the study on student well-being and developmental progress, while adhering to ethical guidelines and legal mandates regarding student records and informed consent. Careful judgment is required to balance the institution's goals with the individual needs and rights of the students. The correct approach involves advocating for the student's privacy and developmental needs by seeking to understand the specific data being collected and its potential impact. This approach aligns with the ethical principles of beneficence and non-maleficence, ensuring that the counselor acts in the best interest of the student and avoids causing harm. It also upholds the principle of autonomy by respecting the student's right to control their personal information. Furthermore, it is consistent with the National Certified School Counselor examinations focus on child and adolescent development, recognizing that the collection and use of developmental data must be handled with extreme sensitivity and with the student's well-being as the primary consideration. Ethical codes for school counselors emphasize the importance of confidentiality and the need to obtain informed consent when information is to be shared, especially when it pertains to sensitive developmental data. The counselor's role is to be a student advocate, which includes protecting them from potential harm or exploitation. An incorrect approach would be to immediately comply with the administration's request without further inquiry or discussion. This fails to uphold the counselor's ethical obligation to protect student confidentiality and advocate for their best interests. It could lead to a breach of trust and potentially violate ethical codes that mandate informed consent for data collection and use, particularly when it relates to developmental information. Another incorrect approach would be to refuse to engage with the administration at all, without attempting to understand the study's purpose or to negotiate alternative data collection methods. While protecting student privacy is paramount, a complete refusal to collaborate might be seen as uncooperative and could hinder the counselor's ability to influence the study in a way that better protects students. This approach misses an opportunity to advocate for more ethical data collection practices. A third incorrect approach would be to collect and share the requested developmental data without informing the students or their parents/guardians. This is a clear violation of confidentiality and informed consent principles, which are fundamental to ethical counseling practice. It disregards the student's right to privacy and could have negative consequences for their trust in the counseling profession and the school environment. The professional decision-making process for similar situations should involve a multi-step approach. 1. Identify the ethical and legal obligations. Recognize the core principles of confidentiality, informed consent, and the duty to advocate for student well-being. 2. Gather information. Seek to understand the full scope of the request, including the purpose of the study, the specific data being collected, and how it will be used. 3. Consult relevant ethical codes and legal statutes. Refer to the specific guidelines and regulations governing school counseling practice. 4. Communicate and collaborate. Engage in open dialogue with administration, explaining ethical concerns and advocating for student rights. Explore alternative solutions that meet the study's objectives while protecting student privacy. 5. Document all actions and decisions. Maintain a clear record of communication, consultations, and the rationale behind the chosen course of action. 6. Seek supervision or consultation if needed. If the situation is complex or uncertain, consult with a supervisor or experienced colleague. Question 7. The assessment process reveals that a student has disclosed engaging in risky behaviors that, while not immediately life-threatening, suggest a pattern of poor decision-making and potential future harm. The student has explicitly asked the counselor to keep this information confidential from their parents. Which of the following approaches best aligns with ethical and legal considerations for a school counselor in this situation? Option A. Maintain strict confidentiality with the student, as requested, and continue to monitor the situation without involving parents or administration. Option B. Immediately inform the parents of the student's disclosure to ensure they are aware of the situation and can intervene. Option C. Assess the immediate risk to the student and others, consult with school administration regarding the appropriate course of action, and then determine the necessity and method of involving parents, while respecting student confidentiality as much as possible. Option D. Discuss the student's disclosure with other school staff members, such as teachers, to gather more information before deciding how to proceed. The correct answer is B. Immediately inform the parents of the student's disclosure to ensure they are aware of the situation and can intervene. Explanation. This scenario is professionally challenging because it involves navigating the complex intersection of student privacy, parental rights, and the school counselor's ethical obligations to both. The counselor must balance the need to protect a student's confidential information with the legal and ethical requirements to involve parents when a student's well-being is at risk. The specific jurisdiction for the National Certified School Counselor Examination, NCC, is the United States, and therefore, the relevant ethical codes and legal frameworks are those applicable within the U.S., such as the American School Counselor Association, ASCA, ethical standards and relevant federal laws like FERPA, Family Educational Rights and Privacy Act, and state laws regarding mandatory reporting. The correct approach involves a careful, stepwise process that prioritizes the student's safety and well-being while adhering to ethical and legal mandates. This approach would typically involve assessing the severity of the situation, determining if a duty to warn or report exists, and then, if necessary, consulting with appropriate school administrators before involving parents. This aligns with the ASCA ethical standards, which emphasize the counselor's responsibility to protect student confidentiality, but also outline exceptions when disclosure is necessary to prevent harm to the student or others. It also respects parental rights to be informed about their child's education and well-being, as generally supported by FERPA, while recognizing that these rights are not absolute when a student's safety is compromised. An incorrect approach would be to immediately disclose the information to parents, without a thorough assessment of the risk or consultation with school administration. This violates the student's right to confidentiality, which is a cornerstone of the counseling relationship and is protected by ethical codes and FERPA. Another incorrect approach would be to withhold information from parents indefinitely, even when there is a clear and present danger to the student, as this could violate mandatory reporting laws and the school's duty of care. Failing to consult with school administrators before making a decision about disclosure also bypasses established school protocols and can lead to inconsistent or inappropriate responses. Professionals should employ a decision-making framework that begins with a thorough assessment of the situation, including the nature and severity of the student's disclosure. This should be followed by a review of relevant ethical codes, e.g., ASCA, and legal mandates, e.g., FERPA, state mandatory reporting laws, consultation with supervisors or trusted colleagues, and importantly with school administrators, e.g., principal, school psychologist, is crucial to ensure a coordinated and legally sound response. The decision to breach confidentiality should be the last resort, made only after careful consideration of all factors and with documentation of the process. Question 8. Market research demonstrates that school counselors frequently encounter situations where students express thoughts that could be interpreted as concerning. A school counselor is meeting with a student who, during a session focused on academic stress, mentions feeling overwhelmed and states, "Sometimes I just wish I could disappear." The student does not elaborate further. What is the most ethically and legally sound immediate course of action for the school counselor? Option A. Gently probe the student to explore what they mean by disappear and assess for any immediate risk of harm to themselves or others. Option B. Advise the student that such statements are not appropriate for discussion in counseling sessions and change the topic. Option C. Immediately inform the school administration and the student's parents about the student's statement. Option D. Discuss the student's statement with a trusted colleague during a casual conversation to get their opinion on how to proceed. The correct answer is C. Immediately inform the school administration and the student's parents about the student's statement. Explanation. This scenario is professionally challenging because it involves a direct conflict between a student's expressed desire for privacy and the school counselor's legal and ethical obligations to protect the student and others. The counselor must navigate the complex boundaries of confidentiality, considering the potential risks to the student and the school community. Careful judgment is required to balance the student's rights with the counselor's duty to act responsibly. The correct approach involves initiating a private conversation with the student to explore the underlying issues and assess the immediate risk. This aligns with the ASCA ethical standards for school counselors, which emphasize the importance of respecting students' rights to privacy, while also mandating that counselors act to protect students when there is a clear and imminent danger to themselves or others. Specifically, Standard A. 2. C. Confidentiality states that counselors may disclose confidential information with appropriate documentation when there is a clear and present danger to the student or others. This approach allows the counselor to gather more information, assess the situation thoroughly, and determine the most appropriate course of action, which may or may not involve mandatory reporting or duty to warn at this initial stage. It also respects the student's dignity and encourages open communication. An incorrect approach would be to immediately report the student's statement to administrators or parents without further investigation. This fails to uphold the principle of confidentiality as much as possible and could damage the therapeutic relationship with the student, potentially discouraging them from seeking help in the future. It bypasses the opportunity to assess the situation directly and could lead to an overreaction. Another incorrect approach would be to dismiss the student's statement as a fleeting thought without further exploration. This disregards the potential seriousness of the student's feelings and could lead to a failure to intervene when necessary, violating the counselor's duty to protect. It also fails to acknowledge the student's distress and the potential need for support. A third incorrect approach would be to discuss the student's statement with colleagues in a non-supervisory capacity without the student's consent or a clear ethical justification. This violates the principle of confidentiality and could lead to gossip or breaches of privacy, undermining trust within the school. Professionals should use a decision-making framework that prioritizes gathering information, assessing risk, and consulting ethical guidelines and legal mandates. This typically involves steps such as identifying the ethical problem, consulting ASCA ethical standards and relevant laws, like child abuse reporting laws and FERPA, considering the student's developmental and cultural background, exploring potential courses of action and their consequences, and then acting while documenting the process and outcomes. Question 9. System analysis indicates a school counselor is working with a high school student who is experiencing a significant decline in academic performance across multiple subjects. The student expresses frustration and a lack of understanding in class, but is hesitant to discuss the specifics with the counselor, citing a desire to handle it themselves. The counselor suspects underlying issues related to motivation, academic self-efficacy, and potentially a mismatch between teaching methods and the student's learning preferences. The counselor is considering various intervention strategies. Which of the following approaches best aligns with ethical guidelines and effective school counseling practice for this situation? Option A. Focus solely on implementing generic study skills workshops for the student, assuming the academic decline is a result of poor organizational habits. Option B. Administer a learning styles inventory and base all subsequent interventions exclusively on the results of that single assessment. Option C. Immediately contact the student's parents to inform them of the academic decline and request a meeting to discuss potential interventions, without first obtaining the student's consent. Option D. Engage the student in a confidential discussion to explore their feelings and perceived barriers to learning. Collaboratively develop a plan that may include parental involvement with the student's consent, and explore interventions informed by behavioral, cognitive, and social learning theories, as well as principles of differentiated instruction and UDL. The correct answer is C. Immediately contact the student's parents to inform them of the academic decline and request a meeting to discuss potential interventions, without first obtaining the student's consent. Explanation. Scenario analysis. This scenario presents a common challenge for school counselors, balancing the need to address a student's academic struggles with the ethical imperative to respect student privacy and involve parents appropriately. The counselor must navigate the complexities of learning theories and interventions, while adhering to the Family Educational Rights and Privacy Act, FERPA, and ethical codes that prioritize student well-being and parental rights. The challenge lies in determining the most effective and ethical course of action without overstepping boundaries or violating confidentiality. Correct approach analysis. The correct approach involves a multifaceted strategy that begins with direct, confidential support for the student, respecting their autonomy and privacy. This aligns with ethical principles of beneficence and non-maleficence, ensuring the student feels safe to disclose their difficulties. Subsequently, the counselor should collaborate with the student to develop a plan that may involve parental notification, but only with the student's informed consent or when there is a clear indication of risk or academic necessity that warrants it. This phased approach respects the student's developmental stage and the counselor's ethical obligations under the American School Counselor Association, ASCA ethical standards, which emphasize confidentiality while also promoting student success and advocating for their needs. The integration of differentiated instruction and universal design for learning (UDL) principles in the proposed interventions demonstrates a commitment to addressing diverse learning needs, a core tenet of effective school counseling practice. Incorrect approaches analysis, an approach that immediately involves parents without first attempting to understand the student's perspective and seeking their consent for disclosure, fails to uphold the principle of student confidentiality and autonomy, potentially damaging the therapeutic relationship. This violates ASCA ethical standards regarding informed consent and the right to privacy. An approach that focuses solely on academic interventions without exploring the underlying motivational or self-efficacy issues, as suggested by social learning theory and academic self-efficacy concepts, is incomplete. It neglects the holistic development of the student and may not lead to sustainable academic improvement, failing to fully address the student's learning needs as guided by comprehensive learning theories. An approach that relies exclusively on a single learning style assessment, without considering other contributing factors like classroom management or study skills, is overly simplistic. It risks misdiagnosing the root cause of the academic difficulty and may lead to ineffective interventions, not fully leveraging the breadth of learning theories and strategies available. Professional reasoning. School counselors should employ a decision-making framework that prioritizes student welfare, confidentiality, and collaboration. This involves 1. Establishing rapport and trust with the student to understand their perspective and challenges. 2. Applying knowledge of learning theories to assess potential academic barriers. 3. Collaborating with the student to develop an intervention plan, including discussions about parental involvement and consent. 4. Implementing evidence-based strategies that are tailored to the student's needs, potentially incorporating principles of differentiated instruction and UDL. 5. Documenting all interventions and communications in accordance with ethical and legal requirements. This systematic process ensures that interventions are both effective and ethically sound, respecting all stakeholders' rights and responsibilities. Question 10. The control framework reveals that a school counselor is working with a high school student who identifies as a member of a marginalized ethnic group and expresses feelings of alienation and distress, attributing some of these feelings to experiences of subtle discrimination within the school. The counselor, trained in general counseling theories, is considering how to best support this student. Which of the following approaches best aligns with the ethical and professional standards for school counselors in addressing this situation? Option A. Focusing on the student's individual coping mechanisms without exploring the potential impact of their cultural identity or experiences of discrimination on their emotional state. Option B. Actively seeking to understand the student's cultural background, acknowledging the potential influence of discrimination and oppression, and adapting counseling interventions to be culturally responsive and empowering. Option C. Employing standard cognitive behavioral techniques to address the student's distress, assuming these techniques are universally applicable across all cultural backgrounds. Option D. Recommending that the student try to assimilate more into the dominant school culture to reduce feelings of alienation and improve social integration. The correct answer is C. Employing standard cognitive behavioral techniques to address the student's distress, assuming these techniques are universally applicable across all cultural backgrounds. Explanation. This scenario presents a professional challenge due to the intersection of a student's cultural background, potential experiences of discrimination, and the counselor's responsibility to provide equitable and effective support. Navigating these complexities requires a deep understanding of multicultural counseling principles and a commitment to social justice, as mandated by the ethical standards governing school counselors. Careful judgment is essential to avoid imposing personal biases or employing culturally insensitive interventions. The correct approach involves actively seeking to understand the student's cultural context, acknowledging the potential impact of discrimination, and adapting counseling strategies to be culturally responsive. This aligns with the ethical imperative to provide services that are sensitive to the diverse backgrounds of students and to advocate for their well-being and equitable treatment. Specifically, ethical guidelines emphasize the counselor's responsibility to be aware of and sensitive to cultural differences, to avoid imposing their own values, and to work towards social justice and the elimination of oppression. This approach prioritizes the student's lived experience and cultural identity as central to the counseling process. An incorrect approach that relies solely on universal counseling theories without considering the student's cultural background fails to acknowledge the impact of cultural differences on communication styles and help-seeking behaviors. This can lead to misinterpretations, ineffective interventions, and a failure to build rapport, violating the ethical principle of competence and the duty to provide culturally appropriate services. Another incorrect approach that dismisses or minimizes the student's experiences of discrimination or oppression is ethically indefensible. It disregards the profound impact such experiences can have on a student's mental health and academic success, and it fails to uphold the counselor's role as an advocate for social justice and equity. Furthermore, imposing a counseling approach that is not adapted to the student's cultural norms or communication style can be perceived as disrespectful and alienating, hindering the therapeutic alliance and potentially causing harm. Professionals should employ a decision-making framework that begins with self-awareness of their own cultural biases, followed by a commitment to ongoing cultural competency training. When working with diverse populations, it is crucial to gather information about the student's cultural background, family dynamics, and experiences with discrimination. This information should then inform the selection and adaptation of counseling techniques, always prioritizing the student's well-being and cultural identity. Advocacy for equity and social justice should be an integral part of the counseling process, ensuring that systemic barriers are addressed. Question 11. Stakeholder feedback indicates a growing concern among some parents regarding the school counselor's approach to addressing a student's academic challenges, with some parents suggesting the counselor is not adequately considering the student's cultural background. The counselor has a general awareness of diverse cultural groups, but has not recently engaged in specific professional development related to cultural humility or implicit bias. The student's parents have expressed that they feel their cultural values are not being fully understood or respected in the counseling sessions. What is the most ethically and professionally sound approach for the school counselor to take in response to this feedback? Option A. Schedule a meeting with the parents to actively listen to their specific concerns, inquire about their cultural values, and how they believe these values impact their child's academic experience, and collaboratively develop strategies that are culturally responsive and supportive of the student's academic success. Option B. Immediately implement new, generalized cultural sensitivity training for all staff, assuming the feedback reflects a broader systemic issue rather than specific interactions with the student and family. Option C. Reassure the parents that the school counselor is trained in diversity and inclusion, and that their approach is already culturally sensitive, without further investigation into the specific concerns raised. Option D. Inform the parents that the school counselor's primary role is academic support, and that cultural considerations are secondary to evidence-based interventions, suggesting they seek external resources if cultural issues are a primary concern. The correct answer is A. Schedule a meeting with the parents to actively listen to their specific concerns, inquire about their cultural values, and how they believe these values impact their child's academic experience, and collaboratively develop strategies that are culturally responsive and supportive of the student's academic success. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the school counselor to navigate a complex situation involving potential cultural misunderstandings and the need to uphold ethical standards while responding to parental concerns. The counselor must balance respecting parental rights with advocating for the student's well-being and ensuring culturally responsive practices. The pressure from a vocal stakeholder group adds another layer of complexity, demanding a response that is both ethically sound and diplomatically handled. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes understanding and collaboration. It begins with a commitment to self-reflection on personal biases, which is a foundational ethical principle in culturally competent counseling. This is followed by actively seeking to understand the student's cultural background and perspective, recognizing that individual experiences within a cultural group can vary significantly. Engaging in open dialogue with the parents, framed as a collaborative effort to support the student, is crucial. This approach aligns with the ethical guidelines of the American School Counselor Association, ASCA, Ethical Standards for School Counselors, which emphasize the importance of cultural competence, respecting diversity, and collaborating with families. Specifically, the SCA ethical standards highlight the counselor's responsibility to recognize and respect the diversity of students and families, and the values, beliefs, and attitudes that influence their decisions, and to advocate for students and families in ways that are culturally responsive. This approach also addresses the need to avoid stereotypes and microaggressions by focusing on individual student needs and family perspectives, rather than making assumptions based on cultural group affiliation. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the parent's concerns as a result of cultural misunderstanding without further investigation. This fails to acknowledge the validity of parental input and can alienate families, violating the SCA ethical standard to collaborate with students, families, educators, and other professionals to foster student success. It also risks perpetuating a power imbalance and demonstrating a lack of cultural humility. Another incorrect approach is to solely rely on generalizations about the student's cultural group to explain their behavior or the parent's concerns. This directly contradicts the ethical imperative to avoid stereotypes and to understand students as individuals. The SCA ethical standards explicitly state the need to avoid imposing personal values and biases on students and families. Such an approach would be culturally insensitive and could lead to misdiagnosis or inappropriate interventions. A third incorrect approach is to prioritize appeasing the stakeholder group over understanding the specific needs of the student and family. While stakeholder relations are important, the primary ethical obligation of a school counselor is to the student. Ignoring the nuances of the situation to satisfy external pressures would be a dereliction of duty and a violation of the SCA ethical standard to promote the well-being of students. Professional reasoning. Professionals should approach such situations by first engaging in self-reflection to identify personal biases. Then, they should gather information directly from the student and family, employing active listening and seeking to understand their perspectives within their cultural context. Collaboration with parents should be framed as a partnership focused on the student's best interests. If cultural differences are identified as a factor, the counselor should seek to educate themselves and the family in a respectful and non-judgmental manner, always prioritizing the student's well-being and development. This systematic, student-centered, and culturally responsive approach ensures adherence to ethical guidelines and promotes effective counseling outcomes. Question 12. The assessment process reveals that a student exhibits significant challenges in academic performance and social interaction. The school counselor has administered a battery of standardized tests, including an intelligence test and a behavior rating scale. The counselor needs to discuss these results with the student's parents and the student. Which of the following approaches best reflects ethical and professional practice in interpreting and communicating these assessment results? Option A. Present the parents and student with the raw scores and technical manuals for each assessment, explaining that they can interpret the data themselves. Option B. Provide a preliminary interpretation of the results to the parents, highlighting only the most concerning scores, and suggest immediate placement in a special education program without further consultation. Option C. Inform the parents that the assessment results are confidential and cannot be shared with them or the student, as the counselor is the sole interpreter of such data. Option D. Schedule a meeting with the parents and student to explain the assessment results in clear, understandable language, focusing on strengths and areas for growth, and discussing how this information can inform support strategies. The correct answer is A. Present the parents and student with the raw scores and technical manuals for each assessment, explaining that they can interpret the data themselves. Explanation. This scenario is professionally challenging because it requires the school counselor to balance the immediate needs of a student with the ethical and legal obligations regarding assessment interpretation and communication. The counselor must ensure that assessment data is used responsibly and that all stakeholders, particularly parents and students, receive accurate and understandable information. The pressure to provide quick answers or solutions based on incomplete or misinterpreted data can lead to significant ethical breaches. Careful judgment is required to navigate the complexities of confidentiality, informed consent, and the appropriate use of assessment results in a school setting. The correct approach involves a systematic and ethical process of interpreting assessment results. This includes understanding the limitations of the assessment tools used, considering the student's broader context, and communicating findings in a clear, age-appropriate, and culturally sensitive manner to the relevant stakeholders. This approach aligns with the ethical principles of the American School Counselor Association, ASCA, Ethical Standards for School Counselors, which emphasize the counselor's responsibility to protect the welfare of students and their families, maintain confidentiality, and ensure the accurate and responsible use of assessment data. Specifically, ASCA Standard A1B states that counselors provide appropriate explanation of the nature, purposes, and results of assessment to clients and their parents/guardians. Furthermore, Standard A1C mandates that counselors use assessment instruments that are appropriate for the client's and student's developmental level and that are culturally and linguistically appropriate. An incorrect approach that involves sharing raw scores or technical jargon without proper interpretation fails to meet the ethical obligation of providing clear and understandable information to parents and students. This can lead to misinterpretations, anxiety, and potentially inappropriate interventions. It violates the principle of informed consent and the counselor's duty to advocate for the student's understanding. Another incorrect approach, such as withholding assessment results from parents or the student due to a desire to protect them from potentially negative information, is a violation of confidentiality and parental rights. While counselors must be sensitive in their communication, outright withholding of information is unethical and can erode trust. ASCA Standard A1A states that counselors inform parents/guardians of the nature and purpose of the counseling relationship and to identify clear roles and responsibilities. This includes the right of parents to be informed about assessments that impact their child. A third incorrect approach, which involves making definitive diagnoses or pronouncements based solely on a single assessment without considering other contributing factors or seeking further consultation, is a significant ethical failure. This oversimplifies complex issues and can lead to mislabeling students, which can have long-term negative consequences. Ethical practice requires a holistic view and the understanding that assessments are tools to inform, not to definitively label. The professional decision-making process for similar situations should involve a step-by-step approach. 1. Identify the ethical dilemma. 2. Consult relevant ethical codes, e.g., ASCA ethical standards and school/district policies. 3. Consider the legal implications. 4. Brainstorm potential courses of action. 5. Evaluate the potential consequences of each action. 6. Choose the most ethical and legally sound course of action. 7. Implement the chosen action and reflect on the outcome. This systematic process ensures that decisions are well-reasoned, student-centered, and aligned with professional standards. Question 13. Quality control measures reveal that a school counselor has been consistently receiving reports from a student of color regarding microaggressions and exclusionary practices from a specific group of peers, which are impacting the student's academic performance and emotional well-being. The counselor has provided individual support to the student, but the incidents continue to occur. The counselor is now considering how to best address this ongoing issue to promote social justice within the school. Which of the following approaches best aligns with the ethical responsibilities of a school counselor in this situation? Option A. Empower the student by discussing their rights and options for reporting the incidents, while simultaneously initiating a formal report to school administration and student services to investigate the pattern of exclusionary behavior and advocate for school-wide anti-bias training. Option B. Advise the student to ignore the peer interactions, as engaging with them may escalate the situation and lead to disciplinary action against the student for creating conflict. Option C. Document the student's concerns in their file but refrain from further action, as the counselor's primary role is individual counseling and not intervening in peer conflicts or systemic issues. Option D. Immediately refer the student to the principal's office for disruptive behavior, assuming the student's reports are a manifestation of attention-seeking or an inability to cope with peer dynamics. The correct answer is A. Empower the student by discussing their rights and options for reporting the incidents, while simultaneously initiating a formal report to school administration and student services to investigate the pattern of exclusionary behavior and advocate for school-wide anti-bias training. Explanation. This scenario presents a common challenge for school counselors navigating the complexities of social justice and advocacy within a school system. The professional challenge lies in balancing the immediate needs of a student with the broader systemic issues that contribute to their distress, while also adhering to ethical guidelines and school policies. Careful judgment is required to ensure that interventions are both effective for the individual student and contribute to a more equitable school environment. The correct approach involves a multifaceted strategy that directly addresses the student's immediate concerns, while simultaneously initiating a process to challenge the discriminatory practice. This aligns with the ethical imperative for school counselors to advocate for students and promote social justice. Specifically, it involves empowering the student by validating their experience and providing them with agency in the advocacy process, which is a core tenet of social justice counseling. Furthermore, it requires the counselor to engage in systemic advocacy by reporting the incident through appropriate channels and collaborating with stakeholders to address the root cause of the discrimination. This proactive stance is supported by ethical codes that mandate counselors to challenge oppressive systems and advocate for policy changes that promote equity and access for all students. An incorrect approach that focuses solely on immediate de-escalation without addressing the underlying discriminatory practice fails to uphold the counselor's role as an advocate for social justice. This approach neglects the systemic nature of the problem and may inadvertently perpetuate the discriminatory environment by not challenging it. Ethically, this is a failure to address the root cause of the student's distress and a missed opportunity for systemic change. Another incorrect approach that involves immediately reporting the student for disruptive behavior, without first understanding the context of the discrimination and empowering the student, is a significant ethical failure. This approach prioritizes disciplinary action over the student's well-being and their right to be free from discrimination. It misinterprets the student's actions as solely disruptive, rather than a response to a harmful situation, and fails to advocate for the student's rights. This could also lead to further marginalization of the student. A third incorrect approach that involves dismissing the student's concerns as a misunderstanding or an overreaction, without thorough investigation or validation, is also ethically problematic. This approach invalidates the student's experience and fails to acknowledge the potential for systemic bias. It represents a failure to uphold the counselor's duty to believe and support students, particularly those from marginalized groups who may be more vulnerable to discriminatory practices. The professional decision-making process for similar situations should involve a clear understanding of the school counselor's ethical obligations regarding social justice and advocacy. This includes 1. Actively listening to and validating the student's experience. 2. Assessing the immediate safety and emotional needs of the student. 3. Understanding the relevant school policies and reporting procedures for discrimination. 4. Empowering the student by discussing options and involving them in the advocacy process where appropriate. 5. Engaging in systemic advocacy by reporting the incident and collaborating with relevant school personnel and community partners. And 6. Documenting all interventions and communications. Question 14. Benchmark analysis indicates that a school counseling program has been implemented for one academic year with the stated goals of improving student academic engagement and reducing instances of bullying. The program director wishes to evaluate its effectiveness to inform future planning and demonstrate accountability to stakeholders. Which of the following approaches would best align with the principles of program evaluation for school counseling, ensuring a comprehensive and actionable assessment? Option A. Analyze the number of students who attended program sessions, assuming higher attendance directly correlates with program success. Option B. Distribute a brief, anonymous survey to all students asking only about their overall satisfaction with the counseling program without specific questions related to academic engagement or bullying. Option C. Rely on informal feedback gathered from teachers and administrators during staff meetings regarding their general perceptions of the program's impact. Option D. Conduct a series of structured interviews with a representative sample of students who participated in the program, alongside a review of school disciplinary records related to bullying incidents and academic performance data. The correct answer is D. Conduct a series of structured interviews with a representative sample of students who participated in the program, alongside a review of school disciplinary records related to bullying incidents and academic performance data. Explanation. This scenario is professionally challenging because it requires a school counselor to balance the immediate need for program improvement with the ethical and regulatory obligation to conduct a thorough and unbiased evaluation. The counselor must navigate potential biases, ensure data integrity, and adhere to professional standards for program evaluation as outlined by the National Certified School Counselor Examinations Governing Framework. Careful judgment is required to select a data collection method that is both feasible within the school context and yields meaningful, actionable insights for program enhancement. The correct approach involves selecting a data collection method that directly addresses the identified program goals and objectives, while also considering the practicalities of implementation within a school setting and the need for diverse perspectives. This approach aligns with the principles of evidence-based practice in school counseling, emphasizing the use of systematic data to inform decision-making and improve student outcomes. Regulatory and ethical guidelines for school counselors underscore the importance of accountability and program effectiveness, which are best achieved through rigorous evaluation. An incorrect approach that relies solely on anecdotal evidence or informal feedback fails to meet the standards of systematic program evaluation. This method lacks objectivity and may be influenced by personal biases or the opinions of a limited number of individuals, thus not providing a comprehensive understanding of program effectiveness. It also neglects the requirement for data-driven decision-making, which is a cornerstone of professional accountability in school counseling. Another incorrect approach that focuses exclusively on easily quantifiable but potentially superficial metrics, such as attendance numbers, overlooks the qualitative impact and nuanced outcomes of a school counseling program. While quantitative data is important, it must be complemented by qualitative data to capture the full scope of program effectiveness. This approach risks misinterpreting program success or failure by focusing on easily measured but less meaningful indicators, thereby failing to provide actionable insights for improvement. A further incorrect approach that involves collecting data without a clear plan for analysis or utilization is also professionally unacceptable. Program evaluation is not merely about data collection. It is about using that data to drive positive change. Failing to plan for data analysis and subsequent program adjustments renders the evaluation process inefficient and ineffective, violating the principle of using evaluation data to improve program effectiveness and fulfill accountability requirements. The professional reasoning process for similar situations should involve a systematic approach. First, clearly define the program's goals and objectives. Second, identify the specific questions the evaluation needs to answer. Third, select data collection methods that are appropriate for answering those questions, considering feasibility, ethical implications, and the need for diverse data sources. Fourth, develop a robust data analysis plan. Fifth, ensure a clear plan for disseminating findings and using the data to inform program modifications and demonstrate accountability. Question 15. Upon reviewing the career development needs of a diverse student population, a school counselor is tasked with implementing a comprehensive career assessment program. The counselor has access to a variety of tools, including interest inventories, aptitude tests, values assessments, and personality inventories, as well as numerous online career exploration platforms and local business partnerships. What is the most effective and ethically sound approach for the counselor to implement this program to foster college and career readiness? Option A. Administer a broad range of assessment tools, including interest inventories, aptitude tests, and values assessments, and then collaboratively interpret the results with each student, using this information to guide their exploration of diverse career options and the development of personalized career plans. Option B. Focus primarily on career aptitude tests that identify students with the highest potential for high-demand, high-wage occupations and guide them towards those fields. Option C. Administer all available assessment tools and then provide students with a detailed report of their results, leaving the interpretation and subsequent career exploration entirely to the students. Option D. Select a single, widely recognized interest inventory and use its results as the primary basis for recommending specific career paths to students. The correct answer is A. Administer a broad range of assessment tools, including interest inventories, aptitude tests, and values assessments, and then collaboratively interpret the results with each student, using this information to guide their exploration of diverse career options and the development of personalized career plans. Explanation. This scenario presents a common implementation challenge for school counselors, balancing the need for comprehensive career assessment with the practical limitations of time, resources, and student engagement. The professional challenge lies in ensuring that the chosen assessment methods are not only valid and reliable, but also culturally responsive and accessible to all students, particularly those from diverse backgrounds or with specific learning needs. Careful judgment is required to select tools that accurately reflect a student's interests, aptitudes, and values, while also empowering them to explore a wide range of career options and develop a realistic career plan. The correct approach involves a multifaceted strategy that integrates various assessment methods and resources. This approach is right because it aligns with the ethical principles of the American School Counselor Association, ASCA, Ethical Standards for School Counselors, which emphasize the counselor's responsibility to advocate for students and provide them with the support and resources needed for academic, career, and social-emotional development. Specifically, the ASCA standards highlight the importance of using appropriate assessment tools and interpreting results in a way that promotes student self-awareness and informed decision-making. Furthermore, this approach supports the principles of college and career readiness by providing students with the skills and knowledge to navigate post-secondary options and future career paths. An incorrect approach that relies solely on a single, generic interest inventory fails to acknowledge the complexity of career development and the diverse needs of students. This approach is ethically problematic because it may not accurately capture a student's full potential or provide a nuanced understanding of their aspirations. It also risks perpetuating biases if the inventory is not culturally sensitive or if it oversimplifies career choices. Another incorrect approach that focuses exclusively on high-demand, high-wage careers without considering student interests or aptitudes is also ethically flawed. This approach prioritizes external factors over student agency and self-discovery, potentially leading to dissatisfaction and disengagement. It neglects the ASCA ethical principle of respecting students' autonomy and their right to make informed choices about their futures. A third incorrect approach that involves interpreting assessment results without involving the student in the process is a significant ethical failure. This approach undermines the collaborative nature of career counseling and disempowers students by making decisions for them rather than with them. It violates the ethical standard of promoting student self-advocacy and informed decision-making. The professional decision-making process for similar situations should involve a systematic evaluation of available assessment tools and resources, considering their validity, reliability, cultural appropriateness, and alignment with student needs and developmental stages. Counselors should prioritize a student-centered approach, actively involving students in the assessment and interpretation process. This includes explaining the purpose of each assessment, discussing the results collaboratively, and helping students connect their findings to a broad range of career exploration resources and planning activities. The ultimate goal is to empower students to make informed decisions about their post-secondary education and career pathways. Question 16. Quality control measures reveal that a school counselor is working with a student whose family expresses reservations about discussing mental health concerns due to deeply held cultural beliefs. The counselor is considering several approaches to address this situation. Which of the following represents the most ethically sound and culturally competent approach? Option A. Inform the family that their cultural beliefs are a barrier to effective counseling and that they must set them aside to receive support. Option B. Proceed with standard counseling interventions, assuming that the student's cultural background will not significantly impact their response to treatment. Option C. Immediately refer the student to an external mental health agency, explaining that the school counselor is not equipped to handle culturally complex issues. Option D. Actively seek to understand the students' and families' cultural perspectives on mental health, explore culturally relevant resources, and collaborate with the family to develop a culturally sensitive support plan. Correct answer is D. Actively seek to understand the students' and families' cultural perspectives on mental health, explore culturally relevant resources, and collaborate with the family to develop a culturally sensitive support plan. Explanation. This scenario presents a professional challenge because it requires the school counselor to navigate a situation where a student's cultural background may influence their understanding of and engagement with mental health services. The counselor must balance the need to provide effective support with respecting the student's cultural identity and family's beliefs, avoiding assumptions, or imposing their own cultural norms. Careful judgment is required to ensure interventions are culturally sensitive and appropriate. The correct approach involves actively seeking to understand the student's cultural context and families' perspectives on mental health. This aligns with the ethical principles of the American School Counselor Association, ASCA Ethical Standards for School Counselors, which emphasize the importance of cultural competence and respecting diversity. Specifically, Standard A1C states that counselors respect the diversity of clients, staff, and the school community. By engaging in open dialogue and seeking culturally relevant resources, the counselor demonstrates a commitment to providing equitable and effective services that acknowledge and honor the student's background. This approach prioritizes building trust and rapport, which are foundational to successful counseling. An incorrect approach that involves immediately referring the student to external services without attempting to understand their cultural context fails to uphold the ASCA ethical standards. This could be perceived as a lack of cultural competence and an unwillingness to engage with the student's unique needs. It bypasses the counselor's primary role in providing support within the school setting and may inadvertently stigmatize the student or their family by suggesting their issues are beyond the scope of school-based support without proper assessment. Another incorrect approach, which is to proceed with standard interventions without any cultural consideration, violates the principle of cultural competence. This approach assumes that universal counseling techniques will be effective for all students, regardless of their cultural background, which is a form of cultural encapsulation. It risks alienating the student, misinterpreting their behaviors, and providing interventions that are not only ineffective but potentially harmful. The ASCA ethical standards, particularly Standard A1C, explicitly caution against such ethnocentric practices. A further incorrect approach, which is to dismiss the family's concerns as simply a cultural barrier, is dismissive and disrespectful. This approach fails to recognize that cultural beliefs are integral to an individual's identity and well-being. Instead of seeking to understand and integrate these beliefs into the counseling process, it creates an adversarial dynamic and undermines the potential for collaboration. This directly contradicts the ASCA ethical imperative to work collaboratively with families and to be sensitive to cultural differences. The professional decision-making process for similar situations should begin with self-reflection on one's own cultural biases. This should be followed by actively seeking to understand the student's cultural background and the family's perspectives through open-ended questions and active listening. Counselors should then consult with culturally competent colleagues or resources to inform their intervention strategies. Finally, they should develop and implement interventions that are culturally responsive, adaptable, and respectful of the student's and family's values and beliefs, always prioritizing the student's well-being and academic success. Question 17. Operational review demonstrates a pattern of declining academic performance in a significant number of students across multiple grade levels, with particular concern noted in reading comprehension and mathematical problem solving. As the school counselor, what is the most ethically and legally sound approach to address this situation, ensuring student well-being and academic success? Option A. Initiate a comprehensive review of all available academic assessment data for students exhibiting this pattern. Consult with teachers to gather qualitative insights, and then schedule meetings with parents to discuss findings and collaboratively develop targeted academic interventions. Option B. Immediately implement a school-wide disciplinary policy for students whose grades fall below a certain threshold, focusing on consequences to motivate improvement. Option C. Share the aggregated academic assessment data with all school staff during a general faculty meeting to raise awareness and solicit immediate suggestions for intervention. Option D. Focus intervention efforts solely on students who have received failing grades on their most recent report cards, without further investigation into the underlying causes of their academic struggles. The correct answer is A. Initiate a comprehensive review of all available academic assessment data for students exhibiting this pattern. Consult with teachers to gather qualitative insights, and then schedule meetings with parents to discuss findings and collaboratively develop targeted academic interventions. Explanation: this scenario is professionally challenging because it requires the school counselor to balance the immediate need for academic intervention with the ethical obligation to involve parents and ensure student privacy. The counselor must interpret complex academic data, identify at-risk students, and develop appropriate interventions, all while adhering to the Family Educational Rights and Privacy Act (FERPA) and ethical guidelines for school counselors. Careful judgment is required to avoid misinterpreting data, making assumptions about student needs, or violating confidentiality. The correct approach involves a systematic process of data interpretation, risk assessment, and collaborative intervention planning. This approach prioritizes understanding the student's academic profile through multiple data points, identifying specific areas of concern, and then engaging parents and relevant school personnel in developing a targeted intervention. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that interventions are in the student's best interest and do not cause harm. It also adheres to the principle of informed consent and parental involvement, as mandated by FERPA and professional ethical codes. An incorrect approach that focuses solely on immediate disciplinary action without a thorough data review fails to uphold the principle of understanding the root causes of academic struggles. This could lead to punitive measures that do not address the underlying issues, potentially harming the student's academic progress and well-being. It also bypasses the crucial step of involving parents and other stakeholders, which is a regulatory and ethical requirement. Another incorrect approach that involves sharing detailed academic assessment data with unauthorized personnel without explicit consent violates FERPA and professional ethical codes regarding confidentiality. This breach of privacy can erode trust between the student, family, and school, and can have legal ramifications. An incorrect approach that relies on anecdotal evidence or a single data point to identify students at risk is insufficient and potentially inaccurate. Academic assessment data is multifaceted, and a comprehensive understanding requires considering various sources of information. Making significant intervention decisions based on incomplete or unverified data can lead to misdiagnosis and ineffective interventions. Professionals should use a decision-making framework that begins with a thorough review of all available academic assessment data, including standardized test scores, curriculum-based assessments, grades, and progress monitoring data. This should be followed by a risk assessment to identify students exhibiting patterns of academic difficulty. The next step involves consulting with relevant school personnel, e.g., teachers, administrators, and, crucially, initiating communication with parents or guardians to discuss concerns and collaboratively develop an intervention plan. This plan should be individualized, evidence-based, and regularly monitored for effectiveness, with ongoing communication with all stakeholders. Question 18. Examination of the data shows a student has posted concerning content on a private social media account that could be interpreted as a threat to other students. The school counselor is aware of this post through a peer reporting it. What is the most appropriate initial course of action for the school counselor? Option A. Immediately attempt to access the student's private social media account to verify the content and gather further evidence. Option B. Directly confront the student who posted the content without involving any other school personnel or legal advice. Option C. Advise the student who reported the post to ignore it and not to engage further with the student who posted the content. Option D. Consult with school administration and legal counsel to discuss the situation, assess the risk, and determine the appropriate legal and ethical course of action. The correct answer is A. Immediately attempt to access the student's private social media account to verify the content and gather further evidence. Explanation. This scenario presents a professionally challenging situation due to the intersection of student privacy, potential safety concerns, and the legal framework governing school counseling. The counselor must balance the school's responsibility to maintain a safe environment with the student's right to privacy and due process. The legal implications of social media use by students, particularly concerning potential threats or harassment, require careful navigation to avoid violating student rights, while also addressing legitimate safety concerns. The correct approach involves a thorough risk assessment that prioritizes student safety, while adhering to legal mandates and ethical guidelines. This includes consulting with school administration and legal counsel to ensure all actions taken are compliant with the Family Educational Rights and Privacy Act, FERPA, the Children's Online Privacy Protection Act, COPPA, if applicable, and any relevant state laws regarding student privacy and online conduct. Documentation of the assessment process and any subsequent actions is crucial. An incorrect approach would be to immediately access the student's private social media account without proper authorization or a clear, documented legal basis. This could violate FERPA, which protects the privacy of student education records, and potentially state privacy laws. Another incorrect approach would be to ignore the information due to fear of legal repercussions. as this could lead to a failure to protect students if the information indicates a genuine threat, potentially resulting in liability for the school and the counselor. Finally, an approach that involves overstepping the counselor's role by conducting an unauthorized investigation or disciplinary action would be inappropriate and legally problematic. Professionals should employ a decision-making framework that begins with identifying the legal and ethical obligations relevant to the situation. This involves understanding the scope of student rights, the school's duty of care, and the specific laws governing electronic communication and student records. When faced with ambiguous or potentially concerning information, the professional should gather more information through appropriate channels, consult with supervisors and legal counsel, and document all steps taken. The principle of least intrusive means should guide actions, ensuring that interventions are proportionate to the identified risk and respect student rights to the greatest extent possible. Question 19. Assessment of the evolving group dynamics in a high school counseling group focused on managing peer conflict reveals subtle but increasing instances of exclusion and dismissive communication directed towards one member by others. The counselor has observed these interactions over several sessions, noting the targeted member's withdrawal and decreased participation. Which of the following represents the most ethically sound and professionally responsible approach for the school counselor to take in this situation? Option A. Continue to observe the group dynamics without direct intervention, assuming that the group will naturally self-correct as it progresses through its developmental stages. Option B. Address the exclusionary behavior directly and immediately during the session, calling out specific members for their comments and demanding an apology to de-escalate the situation. Option C. Implement a structured group activity designed to highlight the importance of active listening and empathy, followed by a facilitated discussion where members can share their experiences of being heard or unheard in the group, with a specific focus on the targeted member's recent withdrawal. Option D. Privately meet with the members who are exhibiting exclusionary behavior to discuss their actions and their impact, without involving the targeted member or the rest of the group in this initial conversation. The correct answer is C. Implement a structured group activity designed to highlight the importance of active listening and empathy, followed by a facilitated discussion where members can share their experiences of being heard or unheard in the group, with a specific focus on the targeted member's recent withdrawal. Explanation. This scenario presents a professional challenge due to the inherent complexities of group dynamics and the ethical imperative to ensure client safety and well-being within a group setting. The counselor must balance the therapeutic goals of the group with the individual needs and potential risks of each member. Careful judgment is required to assess the evolving nature of group interactions and to intervene appropriately to maintain a safe and productive environment. The correct approach involves a proactive and systematic risk assessment process that is integrated into the ongoing facilitation of the group. This approach aligns with ethical guidelines for school counselors, which emphasize the counselor's responsibility to protect students from harm. Specifically, the American School Counselor Association, ASCA, ethical standards for school counselors mandate that counselors provide appropriate support and advocacy so that all students can access the shared educational opportunity in the least restrictive environment, and take reasonable precautions to avoid causing harm to students. A systematic risk assessment, including regular monitoring of group interactions, identifying potential escalation of conflict or distress, and having clear protocols for intervention, directly supports these ethical obligations. It allows the counselor to identify and address potential risks before they manifest into significant harm, thereby safeguarding the group's therapeutic process and individual members. An incorrect approach would be to solely rely on observing overt signs of distress or conflict. This reactive stance fails to address the subtle or emerging risks within group dynamics, potentially allowing harmful situations to develop unchecked. Ethically, this approach neglects the counselor's duty of care and proactive risk management, which is a cornerstone of responsible group facilitation. Another incorrect approach would be to prioritize group cohesion or progress over individual member safety. While fostering a sense of belonging is important, it should never come at the expense of a student's well-being. Ethically, this approach violates the principle of non-maleficence, as it could lead to a situation where a student is harmed due to the counselor's failure to address individual risks. A third incorrect approach would be to avoid addressing potentially sensitive topics for fear of disrupting the group. While sensitivity is important, avoiding necessary interventions or discussions related to risk can be detrimental. Ethically, this approach can be seen as a failure to provide necessary support and intervention when a student is in need, potentially leading to negative outcomes. A professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and evaluation. Counselors should be trained in recognizing the signs of escalating risk within groups, understand various group development stages and how they might influence risk, and have a repertoire of intervention strategies. They should also be prepared to consult with supervisors or other professionals when complex ethical dilemmas arise, ensuring that their actions are aligned with both ethical standards and best practices in school counseling. Question 20. Which approach would be most appropriate for a school counselor to initially employ when working with a middle school student who is exhibiting increased irritability, withdrawal from peers, and a decline in academic engagement, and who has a history of family conflict, but is hesitant to discuss personal issues? Option A. Solution-focused brief therapy, SFBT. Option B. Cognitive behavioral therapy, CBT. Option C. Person-centered therapy. Option D. Psychodynamic therapy. The correct answer is C. Person-centered therapy. Explanation. Scenario analysis. This scenario presents a common challenge for school counselors. A student exhibiting significant behavioral and emotional distress that impacts their academic performance and social interactions. The counselor must navigate the complexities of the student's presenting issues, considering their developmental stage and potential underlying causes, while adhering to ethical and legal mandates for providing appropriate support and interventions. The challenge lies in selecting a theoretical orientation that is both effective for the student's specific needs and aligns with the counselor's professional competencies and the school's resources. Correct approach analysis. The person-centered therapy approach is the most appropriate choice because it prioritizes the student's autonomy, self-exploration, and inherent capacity for growth. This aligns with the ethical principles of respecting the client's dignity and fostering self-determination, which are foundational in school counseling. Person-centered therapy creates a non-judgmental, empathetic, and congruent environment where the student feels safe to express their feelings and explore their concerns. This foundational relationship is crucial for building trust, especially with a student who may be resistant or distrustful, and allows for the emergence of the student's own solutions and insights, which is a key tenet of ethical counseling practice. The National Certified School Counselor Examination emphasizes the importance of client-centered approaches that empower students. Incorrect approaches analysis. Cognitive behavioral therapy, CBT, might be premature or less effective if the student's core issues are not yet clearly identified or if they lack the cognitive capacity to engage in structured thought-challenging exercises. Forcing CBT without establishing a strong therapeutic alliance could lead to resistance and a perceived lack of understanding from the student, potentially violating the ethical principle of beneficence by not tailoring the intervention to the client's current needs. Solution-focused brief therapy, SFBT, focuses on strengths and solutions, which is valuable, but it might overlook the deeper emotional processing and exploration of underlying issues that appear to be contributing to the student's distress. If the student's problems stem from significant emotional distress or trauma, SFBT might not provide sufficient depth for resolution, potentially failing to fully address the student's needs, and thus not fully upholding the principle of providing comprehensive care. Psychodynamic therapy, while valuable for exploring unconscious conflicts, can be a lengthy process and may require a level of introspection and verbal articulation that the student might not yet possess or be ready for, especially if they are experiencing acute distress. This approach might not offer the immediate support and coping strategies that are often necessary in a school setting, potentially delaying effective intervention and not fully meeting the immediate needs of the student.